Hello, my name is Dr. Andrea Peterson, and I am joining you from Coastal Fertility Specialist in our Nexton location in Summerville, South Carolina. Today, I would like to say that it is National Infertility Awareness Week, and this is a topic that is very near and dear to my heart, as I myself also suffered from infertility. I think it's important for us to understand just how prevalent infertility is amongst us. Actually 1 in 6 individuals globally experience infertility. And I think I should take a second to let that sink in, because if we really think about it, if you think about 6 people that you know, at least one of them has had infertility. That's something to be mindful of. I am wearing orange. That is our color for National Infertility Awareness Week. And so, if you're in support of it, I encourage everyone this week to put on something orange to show support for those of us that have suffered from infertility or are currently suffering from infertility. I think that this week can be hard for a lot of people, for those that either have had infertility in the past or are going through treatment or are, have had failures, even those that have had successes but haven't reached their desired family size. Definitely, something for us to be mindful of. Today specifically, though, the topic that we'll be talking about is male factor infertility. The definition for infertility in heterosexual couples, if the female is under 35, is a couple that has been trying to conceive for at least a year. This affects about 15% of couples. A lot of times male and female causes can coexist. The male factor, if there is, some coexisting factors from both of the couple, contributes to about 50% of all cases of infertility. When we're kind of thinking about male factor infertility, really we're trying to think of, are there any reversible or irreversible conditions, and anything that, if irreversible, any contributing factors that we could change to try and stop it. I think another important thing to talk about, though, is that up to 6% of men evaluated for male infertility will be found to have a more serious underlying pathology with something like cancer. And I don't mean to say that to scare anybody. I just think it's something that we should raise awareness for. This actually is something that happened to my husband. He found that he had testicular cancer. And that this happened to us 2 years ago. He was born with an undescended testicle. That's something called cryptorchidism. It's actually a very common condition. It happens in men. 1 in 30 men will be affected by having cryptorchidism. And the treatment for it is to bring down the testicle, usually before the first year of age, if it doesn't descend on its own. The issue, though, is that if the testicle doesn't descend on its own, there's an increased chance that later in life that you can develop testicular cancer. My husband also went to medical school with me, so he was aware of this risk and knew his own history. So he did self-exams quite frequently, and that is actually how he detected it. And it is a condition where the earlier detection, kind of the better the prognosis. And so, I'm happy to report that he's fine, that we are fine. And truthfully, that is not really the reason why we as a couple had infertility. We actually had what's called unexplained infertility. But I digress. So back to our topic today. it really, when a couple comes in, we want to take a detailed history and physical. That's both, well, really, that's the physical part really more for the female. The male, really a detailed history. One of our major things to test a male is to get a semen analysis. On a semen analysis, we usually recommend about 2 to 5 days of abstinence with no ejaculation before getting that study. And on the semen analysis, we're looking at a couple of different parameters. We're looking at the volume of the sperm. We're looking at the motility of the sperm, how much in the sperm are the sperm moving. We're looking at the concentration, how many million sperm that there are per milliliter. And oftentimes the morphology, right? Does the sperm have a normal shape? And is it normal based on the WHO criteria for semen analyses? If the semen analysis is abnormal, usually the recommendation is to repeat the semen analysis again, usually about a month apart, because the semen from ejaculation to ejaculation can actually vary quite a bit. So we would want to confirm that if the semen analysis is abnormal, that it still is abnormal. And then from there, if it is abnormal, then usually the recommendation is that they see a male specialist, usually a reproductive urologist. And then the reproductive urologist is really the one that can kind of do a detailed physical exam. I think that something that can be reversible, that is something that we should address, is the use of testosterone supplementation in men. And so, I think that oftentimes men might use testosterone, and sometimes it's not something that they want to disclose, something that might not want to tell their doctor. They may even keep it a secret from their partner. But using exogenous testosterone, meaning, injecting testosterone into your body to help build muscle, it can have effect on sperm production. And the reason that is that your body will say, oh, hey, look, we have plenty of testosterone. And that will feed back negatively onto the testicles, where the testicles will say, we don't need to continue to make sperm because we have plenty of testosterone. And it'll actually halt sperm production. So the recommendation I have for any patient that's trying to conceive and that is on testosterone, I would recommend stopping it. One of the important things to understand is that, the exposures that your body has today would come out in your sperm 3 months later. So if you had a viral illness, or if you, smoked a real ton of marijuana or did a lot of drugs or something like that, that could impact your semen. And 3 months from now, you could have a semen analysis that seems a little bit off. So, for men, we do recommend really doing the healthiest lifestyle possible. Not smoking, limiting the amount of alcohol that they intake, adopting a more nutritious diet, weight loss if a male is obese, increasing the amount of exercise, avoiding toxic artificial lubricants during sexual activity, trying to live, the most stress-free life as possible. Easier said than done. And then obviously eliminating illegal or recreational drug use. Also minimizing prescription drug use, avoiding exposure to pesticides and heavy metals. Another common thing, and I've had a lot of men ask me this, is, the difference in the scrotal temperature, right? The scrotal is the where the testicle lives in, that's called the scrotum. in their underwear choice, and does that make a big impact? And I don't think that there's really any compelling evidence to say one way or the other, but the general thought is that boxers are better than briefs, and that just because of that concern for scrotal temperature, avoiding things like really hot baths, jacuzzis, saunas, and things like that. If a male, after seeing a male fertility specialist, and on that second check, continues to have a lower semen analysis, then sometimes what that male fertility specialist will do is start them on a specific medication that can kind of help to hopefully increase sperm production. One of them that we actually use in females as well is a medication called Clomid, clomiphene citrate. That is a selective estrogen receptor modulator medication. What that really does is it works to block the estrogen receptor in your brain. So then the body thinks that there's not a lot of estrogen, and then it makes your brain pump out more follicle-stimulating hormone and luteinizing hormone, and that is what then sends a signal to the testicle to then make more sperm. So that's a medication that they usually like to give. And again, we would really see a difference in the semen analysis after about 3 months of being on that medication, because that's how long it takes for the sperm that is made today to come out of the body. If a man has a slightly lower count, in terms of like treatment options for fertility treatment, one of the things we can do is an intrauterine insemination. We usually do that along with ovulation induction, which means we give you medications to make sure that we're growing a nice egg. And then at the time the egg would be being released, we put the sperm into the uterus after it's washed. The washing process really kind of helps remove any dead sperm or cells that don't need to be there, kind of turns the sperm into a concentrated sperm pellet, if you will. And the benefit of that is it's putting the sperm a little bit closer to the egg. If a male's counts are really very low, usually less than, I'd say, 5 million, the recommendation is to do in vitro fertilization. In vitro fertilization is obviously where the eggs are taken out of the female body, and then they're grown into embryos in the laboratory. Now, if a male has male factor infertility, what's really become the standard of care nationally and too at our clinic at Coastal Fertility Specialists is to do something called intracytoplasmic sperm injection. That is where we take an egg, we take a sperm, and we inject the sperm into the egg. The benefit of intracytoplasmic sperm injection is if there's lower counts, you can have lower rates of fertilization. And so with intracytoplasmic sperm injection, you're guaranteeing that the sperm is meeting the egg. And the fertilization rates with that are really quite good. We expect that 70% of the time you take a mature egg and you inject a sperm into it, that there will be fertilization. So that's just kind of like a brief overview of male factor infertility. We would love for you to reach out to us if you have any questions or make a consult to see us. But I'm excited that we could do this Facebook Live on National Infertility Awareness Week, so we can all support each other through the fertility journey. Okay. Yeah. All right. Thanks so much. We'll see you next time. Take care.